Bonjour, je m'appelle Ramatoulaye Kamara. Je suis administratrice de services de santé au niveau de la direction de la santé de la mère et de l'enfant du ministère de la Santé du Sénégal. Je suis dans ce service depuis bientôt 4 ans, mais avant cela, j'étais sage-femme et j'ai fait les différents grades du système de santé et ça fait 18 ans que je suis dans la fonction.
My name is Nalisha Bamwale. I'm a senior planner, budget analyst in the Ministry of Health. I work in the Department of Policy and Planning.
My name is Dr. Daniel Oinaina. I'm an epidemiologist by training and a public health specialist, currently serving as a County Director of Medical Services in the County Government of Nakuru.
Je suis Dr. Makalang Bayangele. Je suis le chef de service de la coordination des soins de santé primaire. Je viens de la République centrafricaine, c'est-à-dire le pays qui se trouve au centre de l'Afrique elle-même, comme ça se dit.
My name is Elizabeth Musa. I'm from Sierra Leone. I work at the Directorate of Primary Healthcare and I'm the National Coordinator for CHOB program.
My name is Dr. Christine Lekurtut. I'm from Laikipia County, Kenya. Currently, I'm working as the County Deputy Director Medical Services. I coordinate service delivery.
My name is Dr. Oscar Goro. I work in Nyeri County as a Deputy Director in Planning, Monitoring and Evaluation, and General Performance Management, including Research.
Je m'appelle Ndeye Dia Diop. Je suis conseillère en santé communautaire. Donc, je suis actuellement en service au niveau du ministère de la Santé et de l'Action sociale du Sénégal, au niveau de la cellule des soins de santé primaire qui est rattachée à la Direction générale de la santé.
My name is Mike Mitoko, Director, Health Policy Planning and Financing. I work in Nairobi County. I've been working in Nairobi for the past 15 years.
I'm Dr. Abdul-Jabir Njai from the Health Financing Unit of the Ministry of Health. I'm a medical doctor. I used to practice, work for the ministry as well in hospitals. But then I faced certain challenges with patients not having access to care and not being able to pay for treatment. And because of that, I became inspired and decided to follow a career in health financing. So I pursued studies in health system strengthening and health economics.
My name is Dr. Paul Musila. I work in Makueni County, one of the 47 counties in Kenya, as the minister in charge, also known as the County Executive Committee member for health.
My name is Karen Chizuni. I work for the Ministry of Health as Chief Safe Motherhood Officer. So I've been working under the Department of Public Health for over 10 years now, managing maternal health services.
I'm Rose Misheni. I am the County Chief Officer for Public Health and Sanitation, which includes coordinating and supervising community health services in the county. I've worked in the Rakanidi for more than 15 years.
What motivated me is the insights that I got from the prior teams that we are working on the project last year. So we interacted with Dr. Kalangwa as well as Mr. Beron that were part of the fellowship last year. So I got interested looking at what they had done with the fellowship within the 9 months that they were interacting with the expertise here and also visiting countries on what other countries had done. Actually, I saw that this could also help me in programming and ensuring that maybe I could be able to help Zambia achieve the aspirations that they have.
I joined the fellowship because last year I got to know about it, the one that happened last year. And one of my officers, actually, I released one of my officers to attend and he gave me feedback that is actually quite insightful. So I felt because I really don't have technical, training in healthcare financing, it will be good for me to actually attend the bootcamp and get it firsthand from the experts.
I'm basically planning and financing, and that is my basic work. So this fellowship program would be a very good asset in undertaking my work.
I wanted to learn more about health financing, especially around Africa. I think being Africans and sub-Saharan African, we have similar challenges. So I wanted to see experiences from other countries, how they've been able to address their health financing challenges and provide access to care for people, and also be able to network with colleagues, see their ideas, and also see how this can apply to Sierra Leone.
I was looking for an opportunity to challenge myself in matters around health financing. I was looking at opportunities to hear and even learn from other participants. I personally am someone who likes learning, and from my interactions with people outside where I work with, and even the fact that we were getting participants from other countries, that was a really big drive for me.
I knew that it's going to help me in trying to sustain the CHW program, to contribute to the sustainability of the CHW program, because I will learn skills here that will enable me to work with the team, to work with the Ministry of Health, and also lead some advocacy for domestic funding in Sierra Leone.
La première chose, déjà, c'est de renforcer mon leadership. Mon leadership et surtout d'avoir les connaissances et les compétences nécessaires pour faire un bon plaidoyer en faveur de, disons, du financement de la santé de la SR-MENA globalement, mais surtout sur la planification familiale. Parce qu'on sait que la planification familiale a un impact positif sur la réduction de cette mortalité maternelle et infantile. Donc pour moi, c'est une nécessité d'avoir le bagage nécessaire pour pouvoir, disons, faire un plaidoyer correct auprès des décideurs pour qu'ils financent un peu et accompagnent le programme de planification familiale et réduire ainsi la mortalité maternelle.
I'm looking forward to learning in terms of how best to mobilize resources, how best, what are the best practices in other countries that are participating in this activity, and also the other counties in the country that are participating. So it's a very, very important activity for me, especially as a county director of health, and to look forward to learning more so that we are able to participate more efficiently in resource pooling, in allocation of resources, and better use towards better health outcomes.
I am excited because I will learn from peers from various African countries, and what I get, the knowledge and the experience, I'll put it into practice.
The knowledge that I'll gain from this training, being a manager, I know when we are capacity built, we are able to manage others at all levels, lower levels, county, and even other departments.
J'aimerais bien visiter le Kenya, surtout au niveau du département de la santé communautaire, pour un peu avoir une idée de comment ils sont organisés, comment ils mettent en œuvre les interventions communautaires et comment ils parviennent à pérenniser les stratégies qu'ils mettent en œuvre. Parce que souvent, le problème que nous avons, c'est le financement pérenne. Et voilà, peut-être en échangeant avec les responsables au niveau du département de la santé communautaire, au niveau du ministère de la Santé, je pourrais avoir un peu une idée par rapport aux stratégies qu'ils mettent en œuvre pour pouvoir pérenniser certaines interventions qui s'amènent au niveau communautaire.
So far, it's quite exciting, you know, being in a session with experts or healthcare workers from different countries. I think the 5 or so countries that are represented here, each with their own experiences. And then even within Kenya, I mean, several counties are represented and we're able to learn from one another.
I know this experience here is going to give me more knowledge, more capacity, and also then greater passion to implement so that we can incrementally improve. At the same time, I'll use the same knowledge to go and capacity build my team, because you can't do alone, you must do as a team. So I'll work with my team members so that I capacity build them, and because I am the second person in the county, now we have a bigger team to be able to train others use the knowledge. We may not do this kind of fellowship, but we look in a smaller way on how we share the knowledge and the skills so that together now we have one common understanding as we move forward in implementing health services, and more particularly resource mobilization, budgeting, planning, utilization, and accountability.
I think the next big thing in my career is to be able to see how I can be involved in the Sierra Leone narrative of transforming health financing and be able to reduce out of pocket and make history in doing that. So that's what I look forward to.